also in my level 2, one of the girls that I ended up working on, she had a lot of pain with her shoulder and it would always pop out. And I remember after treating her during the level 2 course, at the end of the course, we went out for dinner and she was mentioning how for all the days after we ended up treating her, she never had any of those shoulder problems. And I have had a lot of people that I've used that move on that have had terrific results. So that's a terrific one. Then with regard to the hips, hey everyone, thanks for tuning in. Steven here with TV Fork, and today I've got a course review for you guys, and today I'm going to be reviewing the Fascial Stretch Therapy course from the Stretch to Win Institute that was created by Ann and Chris Frederick. The name of the course has recently been changed. When I took it, it was called Fascial Stretch Therapy, and they recently changed it to Frederick Stretch Therapy after the founders. But we're going to get into the actual program itself, and in my 18 years as a coach, this by far has been the biggest bang for your buck course that I have taken. Over 80% of what I do is fascial stretch therapy, and it has been the greatest investment that I've made in my life. So I would highly encourage you to take it. And in terms of who exactly should take this course, if you are a manual therapist, if you are a strength coach, or if you are a personal trainer, I would highly encourage you to take this course. And in terms of who shouldn't take it, if you are somebody who is looking for a self-stretch program, then I wouldn't recommend the fascial stretch therapy course, because this is more for manual therapists or people looking to take people through a particular stretch. If you are looking for more of a self-stretch program, then the Life Stretch course by the Stretch to Win Institute would be more applicable for you. And I am going to be reviewing that as well, because that is also one of the 18 best courses that I've taken over the course of the last 18 years. But now we're going to get into the pros and cons of the course. But first, real quick, like the video and comment down in the comment section, as it would really help me out and help out with the algorithm. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell so you don't miss out on any of the content. And now let's get into the pros and the different levels. With regard to the Fascial Stretch Therapy program, or the Frederick Stretch Therapy program, there are 3 different levels, and then there is a sport-specific course. I've taken all of them, so I'm going to be going through all of them and what exactly they have to offer. I'm not going to make a separate video for each individual level. But in terms of the pros, the number 1 pro is that the classes are very, very small, and the groups are also going to be very, very small. Typically, the classes are going to be 30, maybe 36 people, and there's only going to be 6 people to a group when you are doing these different courses. So there's going to be a lot of different bodies that you can work on and just get a different feel for different types of bodies. In terms of the instructors, there's a great instructor to student ratio. It's typically going to be 1 to 6. So for every 1 instructor, there's going to be 6 students. So it's very hands-on, and you're going to get a lot of attention when you take this course. In terms of level 1 is going to be great if you are looking to increase somebody's flexibility, help somebody improve their posture, or if somebody is in some type of pain and you want to help them decrease their pain. When you do in level 1 is you're going to be taken through a basic table-based assisted PNF stretching routine. I say basic, but it isn't really basic because you learn quite a lot. Your lower body routine, if you end up using all of the moves that you learn in level 1, you could take anywhere from 60 to 90 minutes depending on your pacing and how exactly your flow is when you are performing the stretch. With the upper body stretches that you learn in level 1, if you use all of them, it'll take anywhere from 30 to 45 minutes. And then with the next series, it'll take anywhere from 15 to 20 minutes if you use all of the stretches. So overall, if you use all of the stretches that you use in level 1, you could easily do 2.5, even 3 hours worth of stretches on somebody. So there's a lot of information that you're going to learn, and it is quite overwhelming on the very first day. The very first day, I remember thinking, how the hell am I going to remember all of this? But because of the repetition and doing it over and over and over and working on all of these different types of bodies, by the end of the first week, you're going to feel really, really comfortable incorporating all of these different stretches. Then, once you've done level 1, between each of the different levels, you want to have 100 hours of clinical experience before you upgrade. So once you've done your 100 hours, then you could take level 2. Level 2, this is going to be great if you have patients or clients that have a lot of joint restrictions. And in particular, with this one right over here, you are going to learn 7 different moves. You're going to learn a few other things, but part of the curriculum is the 7 different moves, and then everybody's always talking and sharing different ideas. So you are going to learn a lot more than just the 7, but the 7 moves are the part that is part of the actual curriculum itself. And with these ones, it is up to you to basically determine where exactly in the stretching program you are going to incorporate them. It's not like level 1 where there's this logical sequence. So for level 2, you learn those 7 moves and then you figure out yourself where would it be the most applicable to incorporate those moves into the actual stretching routine. And then 3 in particular that I have found to be the most beneficial in my clinical practice. Number 1 for the shoulders. There's this one move, it's called the butterfly. The butterfly, it's going to target the pec minor. It's great for people that have a lot of shoulder tension. I remember one of the girls that I worked on in my level 2 course, I ended up doing the butterfly on her, and she had so much tension in her shoulders that after we finished it, her right shoulder, I'm not exaggerating, it was about 4 inches lower than her left. and it looked like her shoulder was dislocated. It looked disgusting, and she felt so great. She went into the washroom, and she was kind of freaked out by it. We ended up doing her other side, and then everything went back to normal, but I just remember that so vividly in my head after performing that on her. And also in my level 2, one of the girls that I ended up working on, she had a lot of pain with her shoulder, and it would always pop out. And I remember after treating her during the level 2 course, at the end of the course, we went out for dinner, and she was mentioning how for all the days after we ended up treating her, she never had any of those shoulder problems. And I have had a lot of people that I've used that move on that have had terrific results. So that's a terrific one. Then with regard to the hips, 2 moves in particular that I have found to be absolutely phenomenal. One of them, it's called the Scorpion. The Scorpion, this right over here is going to target the hip flexors and the knee extensors. So you're going to target the psoas and then the quadricep group. And because you're targeting the hip flexor as well, this is going to be great for the rectus femoris. Anybody that has an anterior pelvic tilt or anti-version of the pelvis, this is going to be an absolute lifesaver. So something like a Thomas test. If they fail the Thomas test, definitely the Scorpion will be absolutely terrific to perform on this particular patient. But another one was, for me, myself, the reverse hip opener. The reverse hip opener, if you have limited rotation in the hips, this is going to be phenomenal. And me personally, my hip rotation is a little bit limited. I remember I used to get treated by a fascial stretch therapist because I was too lazy to stretch myself. So I figured if I pay somebody once a week to do it for me, at least I get it done once a week. And the very first time that he ever did the reverse hip opener on me, I remember for about 2 to 3 months, it was very uncomfortable. I did not like that stretch at all. And then after about 2 to 3 months, everything just opened up and became one of my favorite stretches. So a lot of these stretches, what you're going to find is the ones that maybe some people don't find too comfortable, those are often going to be the ones that they need the most. And when you perform them enough, what's going to happen is those are going to be your patients' and clients' favorite stretches. So those are just a few of the moves that you're going to learn in level 2. Then level 3, this one over here, level 3, it's broken down into a fitness and a medical section. Me personally, I took the medical, so I can't speak to the fitness, but as far as I know, it's basically the same thing. The only difference is in the level 3 medical, I believe the only difference is you learn some osteopathic assessment techniques, whereas I don't believe you learn those in the level 3 fitness. Level 3 fitness, anybody who is a personal trainer, yoga instructor, and has completed level 1 and 2 and has done their 100 hours can take it. Level 3 medical, you need to have some type of designation. You need to be either a massage therapist, acupuncturist, chiropractor. You need to have some type of manual therapy background. So with regard to level 3, one of the things is the PMJN series that they go through. And the PMJN, it stands for posture, myofascia, joint, and nerve. And it is both an assessment protocol and a treatment protocol. When you are assessing, you want to assess in that order and you want to treat in that order. So with regard to posture, the first thing you want to do is perform a postural assessment, and you want to get the patient aware of their posture. And for those of you who are interested in learning about postural assessments, I actually did a video a few years ago on how to assess posture. You can check it out right up over here. But with regard to posture, once you've determined how exactly your posture is, then you would move on to assessing and treating the myofascia. With regard to the myofascia, one of the things that's different with regard to level 3 is you learn a lot more manual therapy techniques as opposed to level 1 and 2. In level 3, one of the manual therapy techniques was created by Frederick, who is one of the founders, and it is called the press and stretch. The press and stretch, it's basically a modification of the pin and stretch. The pin and stretch was a manual therapy technique that I had been using for years with phenomenal results. And I don't know if it's Joseph Muscolino's technique or if he just wrote about it, but he has a book, Dr. Joseph Muscolino. It's called the Muscle and Bone Palpation Manual. And in it, he goes over the pin and stretch. The press and stretch, it's basically the pin and stretch. With the pin and stretch, depending on where exactly you find the most restriction in the muscle, you would pin the muscle and then you would stretch it from that point, because there could be restrictions in various parts of the muscle. With the press and stretch, it's basically the pin and stretch, but there's this little bit of a modification, and that tiny modification that Chris had made, it makes a tremendous difference. As soon as I started using it, the amounts of improvement that I would see, and rapid improvements in such a short period of time, were absolutely amazing. So that right there, absolutely great technique. Then once you've assessed the myofascia and you've treated the myofascia, then it's time to move on to the joint. When we are assessing and treating the joints, we're going to get into some gliding techniques, some joint mobilization techniques, and these are great for anybody that has a lot of restriction in the joints. I've had a lot of clients and patients that have had things like adhesive capsulitis and just joint restrictions in general. And these techniques are absolutely phenomenal for anybody with really tight, with really restricted joints. So absolutely would recommend it if you do have patients that have a lot of joint issues. And then once you've done that, then you learn to treat and assess the nerves. With regard to the nerves, you are going to learn the upper limb tension test. The upper limb tension test, it is a way to assess the nerves of the brachial plexus. So you are going to learn to assess and treat the median nerve, the ulnar nerve, the radial nerve, and the musculocutaneous nerve. And then another one of the assessments that you're going to learn is the straight leg raise test and the slump test. The straight leg raise test and the slump test, these are ways to assess and treat the sciatic nerve. Then, if you decide to continue along your journey, they have the sport-specific fascial stretch therapy program. With regard to the sport-specific fascial stretch therapy program, if you are somebody who treats athletes or you coach athletes, I would highly encourage you to take this course. I ended up taking this course just before one of my fighters had one of the biggest fights of his life. I remember a few years ago, one of my fighters, he was headlining Madison Square Garden, biggest fight of his life, and I had just taken the sport-specific course. He had a lot of knee issues, so the entire training camp leading up to that, all I was doing was treating his lower body. But then after I had done the fascial stretch therapy sport-specific course, he wanted me to just do an upper body stretch on him. So when he flew me out to New York, I ended up doing the stretch on him, and I'm not exaggerating, we gained 3 inches of reach on him, and if I have the picture, I'll include it right up over here, but the difference in his reach was ridiculous. And not only that, the next day when I treated him again, a lot of the increases in the range of motion that we got from his reach was maintained. He ended up keeping 2 out of the 3 inches that we ended up gaining, so it was an absolutely phenomenal result that I was able to get from him. In terms of what you could expect in the sport-specific course, you're going to end up spending a day and a half just working on the foot and ankle. And again, like for me, I work with a lot of boxers, so footwork is very important. If you work with anybody that does a lot of running in their sport, so baseball players, football players, boxers, then this would be absolutely terrific. A day and a half just on the foot and ankle, and then we end up spending half a day just on the shoulder. In the shoulder, I have a lot of patients that come to me because of adhesive capsulitis, and the shoulder sequencing that we learned in this course was phenomenal. The amounts of ranges of motion that I was able to increase through using the shoulder series that I learned in the sport-specific course was absolutely phenomenal. So overall, if you do work with athletes, I would highly encourage you to take all 3 levels and the sport-specific program. Overall, one of the best courses I ever took in life, the best return on investment of all the courses I've ever taken, and if I had to do them all over again, I absolutely would do them all over again. Next week, I'm going to be reviewing a new book, going through some new courses, so be on the lookout for that next Thursday, 2 o'clock p.m. If you guys have any questions, go ahead and ask your questions down in the comment section so I can help you guys out. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so I know we keep making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel, hit the notification bell, as I'm going to be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.